Hello, my name is Fabiola Miranda, and in this medical scenario, I am a postpartum nurse at Stars Hollow City Medical Hospital. As a postpartum nurse, a huge part of my role is to assess the physical and emotional status of the patient in the days following her labor. Today, I will be assessing Jane, a multigravida who is primiparous. She had one previous miscarriage, and the child she had one day ago is the first child she has ever delivered. When assessing the new patient, one of the first things to check would be her breasts. You would like to assess whether they are firm and make sure there is no nipple inversion, cracking, redness, or irritation. If she is breastfeeding, you would want to assess her fullness and ask her whether she has been feeding well. The mammary glands do a good job of preparing during the pregnancy and beginning to release colostrum the first few days after delivery. You would also assess the fundus, which is the top of the uterus. You press down on this ball-like structure to assess its height in relation to the umbilicus and to make sure that the uterus is undergoing involution properly. One then also assesses either the incision if the mother had a cesarean pregnancy, or the perineum if she delivered vaginally. If she delivered vaginally, you assess for bruising, swelling, hemorrhoids, and also provide appropriate interventions to help promote her comfort. Another important aspect to postpartum assessment, especially in hospitals that do couplet care, would be the newborn baby, of course. You assess the baby to make sure all the anatomy is developing properly. There are many complications that can go wrong during labor or pregnancy that have a bearing on the baby, in which one should be careful to take into account during the examination. If there was too much or too little amniotic fluid during the pregnancy, this can lead to anatomical or neurological defects, or even meconium staining. If the placenta was abrupted during pregnancy or even removed in pieces during the third stage of labor, this can negatively affect the mother and the baby. If the baby's umbilical cord was seen to be missing 3 of its respective arteries and veins, this can also negatively affect the baby. There are many physiological aspects to consider when assessing mother and baby, but it is also incredibly important to not forget the emotional health of the mother. The postpartum period is crucial for the mother, and one must assess her for any psychiatric disorders she may have. The 3 crucial disorders to look out for are for postpartum blues, postpartum depression, and postpartum psychosis. Postpartum psychosis is the most serious of the 3 and the most rare, only showing up in 0.1 to 0.2% of all women. The symptoms show up a few days after delivery and include depersonalization or hallucinations. Risk factors for this include a previous history of bipolar disorder. That is all. Thank you.